Hi you guys, welcome back to another video. It is Shamyra and I'm here to do another how to look up CPT codes in your CPT book. So make sure you guys have your books ready. Feel free to pause the video before I get through the answers to see if we come up with the same answer. Don't forget to leave a thumbs up, comment down below, and subscribe if you guys have not subscribed already. Let's get into it. Our very first one, we have a patient with Bartholin's gland cyst presents to the clinic for incision and drainage of the cyst. Due to the size and area of the cyst, the physician decides to incise the cyst and suture the lateral sides, leaving one side open for drainage. Which of the following codes would represent the physician's work? So this question was a multiple choice question, but you guys know I like to just give you guys the answer. That way we can just get straight to it. But I did want to break this question down. So it says the patient came in with a Bartholin's gland cyst, and we were planning on doing an incision and drainage. So automatically you should be thinking of IND, of a cyst. And it also says due to the size and area of the cyst, the physician decides to incise the cyst and suture the lateral sides. When you have a regular incision and drainage procedure, that is all you are doing. You're incising it and you're draining it and you leave it alone. I mean, sometimes they might pack it with like gauze or something like that, but all they did was incised it and drained it. However, this physician decided to suture the lateral sides as well. So we didn't leave it, it's left open, but he also sutured the sides of the cyst or the skin, and that type of procedure is called marsupialization. So let's get into our CPT book and see if we can find the right code. Make sure you always start in the index section, especially if you are taking the CPC exam. Never just jump to the series that you think the code belongs in and try and look for your code. Always start in the back to look it up and then go to the front section to confirm that your CPT code is correct. So I am here at incision and drainage, and we see Bartholin's gland right here, and that code is 56420. So now I'm just going to flip to the front section of my book and confirm if this code is correct or not. So right here we have 56420, incision and drainage of Bartholin's gland abscess, and then I also wrote /cyst. But remember, our provider sutured the sides, so we're going to be looking for a marsupialization of Bartholin's gland cyst. And I have a note here that says slit plus suture edges remains open. So feel free to write this down in your book. If you guys like information like this in your book, I love it from when I'm trying to figure out if this code is correct or not. So when we get back to our question, what do you guys think the answer is going to be? Obviously, it is going to be the 56440. And moving right along to our next question, a pediatrician performed a routine circumcision on a newborn baby boy in a hospital setting. The physician anesthetized the area with dorsal penile block, clamped the foreskin away from the tip of the penis, and excised the excess foreskin. What is the correct code for the circumcision? So where we need to pay attention when it comes to circumcision is how they performed the procedure. And when I say how, I mean like what they did, what they used, how they did it. That is the information you want to pull from the notes. So this procedure, he anesthetized the area with a dorsal penile block. He clamped the foreskin away from the tip of the penis and excised the excess foreskin. So we used a dorsal penile block and he clamped the foreskin away. So let's look into our CPT book, starting in the index, and we're going to go to circumcision. Right here we have circumcision, and you see we have two options for repair or surgical excision. This was a surgical excision, and right below that says neonate, which is another term for newborn. So we have 54150 or 54160. I always say to write down those codes so that way you don't have to flip back and forth, but they should be like right next to each other because they're so close, so you shouldn't have to do much flipping. So once we get over here at the 54150 and 54160, let's look at these two codes so we can determine which one would be correct. When we look at 54150, it reads circumcision using clamp or other device with regional dorsal penal or ring block. 54160 reads circumcision, surgical excision other than clamp device or dorsal slit, neonate, 28 days of age or less. So we want to make sure we pay attention to what the provider did. This physician used the dorsal penal block and he clamped the foreskin. So 54160 read surgical excision other than a clamp. So using something other than the clamp. This documentation says clamped with the dorsal penal block. So not the dorsal slit. Make sure you pay attention to the wording. So the correct code would be the 54150. And feel free to write down that Z41.2 diagnosis code. This is the routine circumcision diagnosis code that should go on with this 54150 or 54160 code. I also have written for MA medical assistants, they like to have the Z38 point. I think it's 00 or 01 or Z38.02, depending on how the delivery was done. So if it was vaginal delivery, they want that code first and then Z41.2 as their secondary diagnosis code. Or if it was a cesarean delivery, they want the Z38.01 first and then the routine circumcision second. That is how Pennsylvania medical assistants policy is. I'm not sure what it would be for your state, but I have this information written in my book so I can remember to put the Z38 point whatever first and then the Z41.2 second. Moving on to our next question. On this slide here, we have two questions, but we're going to look at the first one first. So a physician performed an endoscopic resection of a 2.3 centimeter bladder tumor. What is the correct code? Well, this endoscopic resection kind of made me think to go to endoscopy first. So let's jump into my CPT book so we can get to endoscopy and see what we see. Here we are at endoscopy, and I'm just going to look for bladder right up here, and then I see excision, and then tumor is indented at 52355. I kind of feel like there should be a term for resection, so I'm just going to keep looking through and see if we find it underneath endoscopy. I see rectum, but I do not see resection. So let me just confirm that the 52355 is the only one listed here. And then we're going to read that code description in the front of our book. And right down here, we have the 52355, and I see that this is an indented code, so you kind of have to see where the beginning of this description started, and it started at the 52351. It says cystourethropy with ureteroscopy and or piloscopy diagnostic. We did not take a scope up through the ureter, and that is what that ureteroscopy is. So this is not the correct code. 52355 is not correct. So we need to go back to the index and look for resection and then see if we find bladder tumor. Right there in the middle, I see it. It says tumor bladder. So we are going to look at 52234, 52235, and 52240 in the front of our book. The description for 52234 says cystourethropy with fulguration, including cryosurgery or laser surgery and or resection of a small bladder tumor 0.5 up to 2 centimeters. 52235 reads medium bladder tumors 2 to 5 centimeters. And then we have 52240 for large bladder tumors. I'm assuming that would be greater than 5 centimeters since they didn't give us any measurements. This patient had a 2.3 bladder tumor, so that would be a medium-sized bladder tumor, 52235. And I did want to mention cystourethropy. If you guys are wondering, like, well, he didn't say anything about the urethra, but in order to get to the bladder, you have to go up through the urethra. So for this endoscopy procedure, the scope goes through the urethra in order to get to the bladder. So the cystourethropy is correct. Our CPT code for this procedure is going to be 52235. Moving on to our bottom question, a physician performed a cystourethropy with ejaculatory duct catheterization and irrigation. Duct radiography was also performed to visualize ejaculatory duct system. So it sounds like we have two procedures going on in here. So let's look in our CPT book, and the first thing we are going to look up is cystourethropy. And we're going to be looking for something about ejaculatory duct catheterization because that's what stands out to me. And then we're also going to look for the duct radiography. And right here underneath cystourethropy, we have catheterization, ejaculatory duct, 52010. But I'm also going to look for that radiography to see if there's any information for another CPT code. It tells me to go see X-ray, so let's go to X-ray. And I don't see anything about catheterization or ejaculatory duct, anything about the bladder. So I'm just going to go to that code that we came up with, which was the 52010 in the front, and then we are going to read that description. Right here it reads cystourethropy with ejaculatory duct catheterization with or without irrigation, installation, or duct radiography exclusive of radiologic service. So that actually included our duct radiography. So we do not have to build a separate code. Everything that the provider did for this procedure was in this 52010 code. So when we get back to our question, the correct answer is going to be 52010. For our last question, we have a 79-year-old male patient in a rehab hospital. Status post hip transplant is having trouble voiding. After his last voiding, the physician measured his bladder capacity using a non-imaging ultrasound device. How should you code this procedure? So what I have highlighted for this question is, it says the physician measured the patient's bladder capacity using a non-imaging ultrasound device. So that tells me this is going to be a urodynamics type of procedure. Urodynamics is when they are measuring the bladder functions. And this patient looks like was struggling with voiding. So in the back of our CPT books, we are going to go to urodynamics. right here under urodynamic tests, it says bladder capacity ultrasound 51798. So let's go to the front section and just review that description. And right here, that code reads measurement of post-voiding residual urine and or bladder capacity by ultrasound, non-imaging. So when we get to our question, the correct answer is going to be 51798. And that is our last question that we have. Make sure you guys leave a comment down below if you have any questions with the ones that we went over, and I will get back to you. Don't forget to give a thumbs up. And make sure you hit that subscribe button. I will see you all in my next video. Bye.